Hi, I'm Dr. Carol McCulloch, one of the doctors at Advanced Orthodontics, and this is my partner, Dr. Todd Steinhart. So I have been an orthodontist for a long time. I'm not sure if I actually want to admit how long because it makes me very old. But what I would say is orthodontics has really changed over the years, and it's been a real privilege to be able to go through the journey of changes and to be able to adapt and learn all the new technologies that we've been able to incorporate into this amazing practice. I think we really shine in the area of multidisciplinary treatment. I think Dr. Steinhart and I work really well with other clinicians to tailor a treatment plan for you that might involve restorative work, implants, or maybe surgery, or even more radical changes in your smile if that's something that you're looking for. I think experience matters. I've been doing this for a really long time. I actually graduated before Invisalign was a thing. And I think I've spent most of my career doing continuing education to kind of learn and adapt to all of these new things. And I think we really offer the latest, greatest, and best. Also, I think we can offer you experience with kind of like the voice of reason, if you will. A lot of people think a lot of things are super awesome. I think we try to be moderate adapters. We're not always the first ones to jump in. We sometimes like to let others make mistakes before we adapt to new technology so that we can kind of hone things and make it the best for us and also for you. What do you think, Todd? What we're really finding is that as people age, there are age-related changes to the dentition, and it used to be that orthodontics was for the young, and what we're really finding now is that because of the age-related dental changes, later in life, a lot more people need to come in pre-restorative work and to correct the age-related changes that happen, kind of like plastic surgery, but in a microform.
Thanks, Kara. I appreciate that. Absolutely. Most people think of orthodontics as just for kids and just for smiles or, just for aesthetics. And what Kara was kind of leaning towards is that, orthodontics has changed a lot, and as we age, there's a lot of age-related changes to your bite, to your dentition. Dr. McCulloch and I, sure, we treat a lot of kids and do Invisalign and braces and those fun things, but what Dr. McCulloch on the island here is really specialized in is the multidisciplinary care. We're really good at working hand in hand with your general dentist to fit the needs for your bite, for your smile, and those changes. It's almost like plastic surgery, where as we age, we want to correct a few things here and there. We really kind of hone our skills to meet those needs for your dentist. We're really communicative with the community, and Kara has a legacy here in this greater Seattle area as one of the best multidisciplinary doctors in the area, if not the country. So even if you think orthodontics is just for kids, I can honestly tell you that we treat maybe 20% of our patients happen to be big kids, if you will. So please let us know if there's any needs that you have, or your general dentist has any work that needs to be done, and we can work hand in hand to really give you that smile and that experience that really fits your needs. It truly is a privilege and an honor to be the sixth orthodontist to come in here into Advanced Orthodontics, and used to be Mercer Smiles. I am new, like I say, within about 2 years in the practice. I'm not new to the industry. I've actually been practicing for 20 years. I just recently sold my practice that I had for 10 years in Sammamish, where I used to live and work. A big part of coming aboard here was that my wife grew up on Mercer Island. She has a legacy as well of about 50 years from her parents all the way up to now nieces, nephews, and grandkids. I really pride myself on being part of the community, and I think there's no better place than Mercer Island to be part of. I'm running into my patients at the grocery store, at school events, things like that. I think that's one part of being an orthodontist that makes my career just amazing, and it's really worthy of that. I have my kids running into the practice over lunch. I get to see all their friends. It's been an amazing opportunity. I can't thank Dr. McCulloch enough for bringing me on and giving me the trust, but she's also given me the tutelage as well. As I said before, Kara has been an orthodontist here for a while, and she's built great relationships, but more importantly, she's built the trust of the community. So a big part of me coming on was I'm as involved as I can be in the community. I'm on different school boards. We sponsor school teams. I think it's really important that local businesses really work with the rest of the community to be taken take care of the kids, take care of the adults. So I can't thank you enough, and I'm really excited to be part of this team, and I hope that I can just build upon this amazing legacy that Kara has built on as well, and be next in line to give people amazing smiles, and more importantly, give people amazing experiences with family, with friends, and the rest of the community. So thank you.
So I was recently asked about my career as an orthodontist, and I went to dental school in Vancouver, Canada, at the University of British Columbia, and then I came down and did my orthodontic residency and my master's at the University of Washington. And then I had the very good fortune of working for some of the real awesome legacy type orthodontists around town. I actually worked as an associate orthodontist for others for about 15 years before joining Dr. Bill McNeil here. And this is an interesting practice. It's been around for more than 50 years, and I am the 5th orthodontist who has owned and run the practice. And I handpicked Dr. Steinhart to take it over for me because I think he's going to take great care of you and all of our patients as I move into, I'm not going to say retirement, but into a different pace of my adult life.